So we start to work by defining clearly the margin of the prep. This is extremely important. You see, again, it's the lateral of the pencil. It's not the tip, because the tip you put it where you want, but the margin, the lateral of that pencil will intersect the margin where it should intersect it. That's at the real margin of the prep. So you see, this is why the prep has to be very well made by the dentist and very well reproduced in the impression, captured in the impression, reproduced on the plaster model. So once we did that, you see it's a Geller model. Once we did that, we apply the stone hardener, ethyl acetate, and this will harden the plaster. It ensures that the plaster will not be scratched. Yeah, it will not chip, it will not be scratched while touching it with the instruments, because you'll see that there's going to be a lot of contact between metal instruments and that plaster margin especially. So now we wait for it to dry, and we put some wax over this dye, right? This is the dye, on the plaster dye, and the same thing in the mouth. I mean, the correspondent in the mouth of this thing is what we call the abutment, which is the prepared tooth. So now we want to make sure that there is enough space to for the crown to sit perfectly without intersecting any sharp angles left at the preparation. Yeah, normally the dentist should make those margins round, but the technician wants to make sure that the crown will fit, so she's adding a little bit of wax to make sure that there's going to be enough space for the cement. And you see, it's adding even more wax. How much space you need for the cement? Well, enough. That's the answer, enough. If it's too much, well, it's not that much, because that wax is kind of thin and the technician knows what she's doing. Otherwise, you will have to apply a number of spacers. And the spacers, we have special spacers of 10 microns, 7 microns, 14 microns per layer, it depends. But now the technician, she knows what she's doing. She was a very, very good technician, extremely skilled and experienced, and she knows how much wax to apply, so that now just smoothening the wax, the foiling wax, actually it's a foil of wax there, yeah, now she only has to apply the spacer, one layer of spacer. That's a faster way to work, because otherwise the spacer, you have to wait for it for 10-15 minutes, even more than 15 minutes sometimes, to dry, and then to apply another spacer and another spacer, and then what are you doing there? Yeah, it takes too much time. But now you see we can apply the spacer in only one layer, because we already did space with wax previously. So the spacer is applied not to the shoulder, to all the abutment, to all the dye, but not to the shoulder. And yeah, I have to be very careful. The best thing is to do it under magnification, to be extremely precise. Yes, it's true that afterwards, when you have the metal framework or the metal crown like here, you can still trim from the metal to make sure that it fits in the mouth, but the best thing is to do it correctly from the very first time, and then technician and dentist will work less, and the patient will be happier, because there's not gonna be a lot of trouble, and the mouth of the patient open to define the perfect axis of insertion, and where it does not go enough, where it touches prematurely and things, so the patient will be very happy if things go like shooting, right? So now we have to wait for it to dry. It takes, like I said, 10-15 minutes, and now we apply the separating fluid that's kind of oily. Normally it's oil-based. Most of the time it's oil-based. Some people just use Johnson baby oil or olive oil, or yeah, but there are special liquids to do this job, and they're definitely better because that's what they're made for. And now we introduce this into melted wax in an angle. If we put it perpendicular like that, there's gonna be air trapped under the cusps, right? So we don't want to have this happening, and so we introduce it at an angle like 30-45 degrees. We do it quite quick while we introduce it. Pay attention. Yeah, right. And then we take it out slowly. Right? And then this coping will be kind of uniform. And if it is thicker, it's thicker only on the occlusal side of that die. So we don't have to remove it like, a little bit and then more and then more and then more, because then the wax will have some markings, some undercuts. No, we have to remove it slowly and continuously so that you see now the wax is really smooth. And then we add some wax, brittle wax, for the cervical zone. It's in order to reinforce that zone and to make sure that if there are undercuts, who knows, maybe there are and we didn't see them. If there are undercuts, this brittle wax will break. So we want it to break if there is any problem there, right? Because otherwise we may have a problem and not know it. If that is elastic, and many waxes are really elastic, and then it's a problem because it will come out easy, but when you transform it in metal, right, when you cast it, it will not go in there anymore, and the dentist will have problems placing the restoration in the oral cavity. So we want to make sure that everything is perfect, so we use this type of kind of brittle wax. And now once this is done, we eliminate with a heated spatula, we eliminate the wax that was captured or that remained sticked under the margin of the prep. So you see, it's very important to have a clear margin. In that region, it must be very, very nicely adapted, and this is to prevent also rotation of the crown. So we don't put something there in order to remove everything, because we will lose our precision, but we simply first of all use a heated spatula to remove most of that layer of wax, thick layer of wax. Of course, then we cut the remaining wax from the root, so to say, of this die, the part that will go into the plaster alveolar of the model. And now we place it back on the model. I have to make sure that everything is clean, that there's no wax in between, and the removable die and the model. And slowly we try to respect the anatomy and to create the anatomy of the crown. We know how to model a first upper molar, absolutely. We said we want to make it in metal, all metal, so then the modeling will be full anatomic, right? So we'll transform everything afterwards by investing and casting. We'll transform it in metal, right? I'm mentioning this because otherwise we should have left things kind of like this in order to have enough space to place the ceramic. So have this cast in metal and then place the ceramic over. But here, no. Here we want to do everything in metal. So we're building, we're building the molar like in the first grade. when we were really doing the modeling in wax, when we learned morphology. So this is the palatal cusp, and you see this is what we call the gnatologic way of modeling. That's bringing every cusp in the right place in relationship to the opposing arch, to the opposing teeth. Now, if you do this digitally, you don't have to do that. You will be given a shape suggested by the software. But then, if you want to do some modifications to make them look nicer, then you will have to, to modify a little bit with some instruments that are kind of similar to what the technician is having here, just as virtual. Not such a big difference. Now you see she comes with more wax in order to ensure the contact point to the second molar, and this is the carabelli that she tries to initiate now. So you see, she's trying to do the occlusal first, starting with the occlusal. That's the most important thing for her, to place the cusps where they should be placed. Normally, you would think, oh wait, let's start with the labial side, with the buccal side. No, the occlusal side is first. Gnatologic. I want to see exactly where the bite will be supported, where it will touch with the antagonists. So only then we do the margin, the vertical walls, right? So it's very important how you look at that, from which angle. See, if we look like this, now we have to see that the cusps correspond to the cusps behind or in front. The line has to be kind of continuous, right? And also the margin from the buccal, we have to see the correspondence of all the cusps of all the teeth in the mouth. You know that from morphology, but this is very important. You see, where is the maximum convexity here? Yeah, it's close to the gum. So when you look from the occlusal, you see the buccal more or less, and the same with the palatal side. So when you see it on one molar, you have to see it in the same time on the other molar. So you have to see how much you see from each side when you look, to make it corresponding with the neighboring teeth and with the analogs. That's the teeth from the other arch, from the opposite side. So you see the technician has been placing wax now on the buccal side and on the palatal side as well. And now she is finalizing the inside of the occlusal surface. And here we have two. People say that there's an oblique crest. Yes, it is an oblique crest, but actually there are two crests that build the oblique crest. So that was the modeling of it, and there's a little bit to be arranged in the sense that it has to be smoothened. See? The closing has to be perfect at the margin. And now we smoothen everything. And now we shall clean the rest of wax with an instrument, scratching actually on the margin of the die, actually in the zone of the margin of the prep. And that's why I said that it's very important to have that strong and tough plaster, hardened even. Yeah. So now we're sure that the wax sits in place, that it is smooth enough, it looks anatomically correct. Of course, the technician has checked everything with the antagonist. Some more morphological details, yes. And now, you see, there's the margin that you can see through there, the pencil that we used. And now we clean, as I said, we will kind of scratch there. Of course, we don't do it with anger, right? we have to be very attentive and very careful when we do that. But anyhow, it has to be hard, the plaster. So now we removed everything. And you see there's still to clean, because there's blue remaining on the wax. That means that the wax has passed over that blue marking, which should be the perfect and final margin, right? So a little bit more to be cleansed, as you see here. And this is how it looks on the model.